to the last video in this series of managing your gestational diabetes through diet and lifestyle. In this last video here, I want to discuss the last few weeks of your pregnancy. So it might be tempting towards these last few weeks to loosen up a little bit on the diet and lifestyle, but actually this is a really important time to continue controlling your blood sugar levels because it's a key area of development for the baby. So continue with your regular blood sugar checks 7 times a day, before and after each of your meals and directly before you go to bed. Make sure you're continuing with that regular meal and snack pattern and keeping up your regular physical activity. Make sure you're still filling in your diary and sending it to us every 2 weeks, and try to keep up with your food diary too. So we're nearly there with the last few weeks of your pregnancy, so just make sure that you are planning some sort of a treat, have something packed in your hospital bag that you're looking forward to throughout your pregnancy, or book something for yourself after, because you've put in a huge amount of work over the last few weeks and it's been a really difficult time managing your gestational diabetes as well. After you've delivered the baby, you no longer need to continue checking your blood sugar levels. We will ask you to come back into us for a postnatal glucose tolerance test. You'll get a letter in the post about this, but this is normally scheduled for roughly 6 weeks after your due date. This is to check that you no longer have diabetes. We do still recommend that you continue a regular meal and snack pattern after you've delivered the baby. It's really good to help fuel you during this really busy time. Try to choose healthy foods most of the times. Because you no longer have gestational diabetes at this point, you can start to include some more of those higher fat, higher sugar, more processed foods in your diet occasionally, but we still recommend that you continue healthy eating most of the time. Try to establish a set family meal routine if possible at home. This is really important as an overall family and will be really helpful for the development of you and baby together around family meal times. Try to get out for some exercise and keep up regular physical activity after the baby is born. If possible, try to get the baby out with you too. While you're breastfeeding, you will be burning more energy and you'll probably feel a lot hungrier, so try to keep up regular meals and snacks throughout the day. Healthy snacks while breastfeeding are things like a glass of milk, a yogurt, fruit, nuts and seeds, oat cakes, flapjacks, cereal bars. These are all really good snacks to include. They're quick, easy, on the go to have while you're breastfeeding during this really busy time. Also try to include more fluids while you're breastfeeding too. Now that you've had gestational diabetes, you are at a higher risk of developing type 2 diabetes in later life. There are some things that you can do that can help to reduce your risk of developing type 2 diabetes. This would be things like trying to maintain a healthy weight after pregnancy. Keeping up regular physical activity can help to reduce your risk of type 2 diabetes. Continuing with a healthy diet, and actually breastfeeding can also help reduce your risk and the baby's risk of developing type 2 diabetes in later life. And again, just remember that we will be asking you to come back and do your glucose tolerance test about 6 weeks after your due date, just to make sure that you don't have diabetes anymore. And you will be asked to just check in with your GP every year just to make sure that you haven't developed type 2 diabetes. In future pregnancies, you are at a higher risk of developing gestational diabetes. So if you become pregnant again, we would recommend to just start on the gestational diabetes diet from the get-go. You will be getting another glucose tolerance test around the 20-week mark, maybe another one at 24 or 28 weeks to check that you don't have gestational diabetes. As soon as you know you're pregnant, like I said, try to reduce your high sugar foods, eat regular meals and snacks, just watch those portion sizes and try to keep up that regular physical activity. So that's it from the last video of our series on managing your gestational diabetes with diet and lifestyle factors. Thank you so much for listening and best of luck with the rest of your pregnancy.